support?
Yeah, I mean, it's really interesting because obviously we're kind of, as a patient advice and advocacy service, we're kind of at the sharp end, if you like, and we're very often seeing those women who are absolutely not getting the help and support they need. And obviously we don't see the ones who do get help because they're not interested, they don't need to come to us. But we do see, as I said, you know, the group itself is 19,000. I'm scratching the surface. Menopause support, you know, there's an awful lot of people out there. And so interestingly, you know, sort of we looked recently at menopause, at training within university level, just at medical school, because for me, it would make total sense if every healthcare professional had a basic understanding of menopause, because it, as you well know, it affects so much of a woman's health and well-being as she gets older. And, you know, over 40% told us that they taught nothing in medical school. And yet when we talk to the RCGP about the Royal College of GP, you know, the 3-year training, they say it's in the curriculum. Well, yes, it is in the curriculum, but it's an e-module that you have to elect to do. It's not mandatory. So it does kind of seem as though there are, you know, sort of, there are resources out there. We just need everybody to have this kind of, this basic understanding of what fluctuating and depleting hormones can potentially do. And I think from a, you know, sort of from a wider perspective, it wouldn't just help women, it would potentially save the NHS a lot of GP time, particularly, but also a lot of NHS money.
Totally agree. Totally agree. I mean, the thing, curriculums have moved on. And if you look at curriculums now, medical students do come through, obstetrics and gynecology trainees do come through and do some menopause. But I would, as I referred to earlier, and I think that in itself is good, but it's not enough. I think the issue is the practical application, because of course, you would say as a healthcare professional, you should, whether you're working in any specialty, you should at least be able to signpost the woman where to go. So let's say you're working in any area, okay, it'll be great if people are able to advise, but one has to be realistic and say, you know, if you're working in XY specialty, you'll not be able to advise. But at least, like you said, to have the basic understanding to say, you know what, this is likely to be related to the menopause, and look at this website, at the BMS website, you could speak to so-and-so, your GP, etc., or try and say, so to be able to guide people to where they could be, get information. So signposting, so that basic awareness is essential, I would say, for all. I think what we would like to see is that next step of saying, you know, I do believe there are lots of people who are confident and competent in offering it, but you want to see it available more across the board. Because like I said, for you as an individual, it's your postcode, and if it's not available for you in your postcode, you're affected. And if you're going to say, well, let's say 80% or 90% is available, but if you're in the 10% or 20%, for example, where it's not, that can have a significant impact. And like you said, it's got an effect on the quality of life of the individual woman, her relationships, well-being, but also, like you said, referrals, impact on clinics, impact on the workforce, impact on the economy indirectly. So, and when you think of, you know, life expectancies exceeding 80 in most, you know, Western countries, you could say a third of a woman's life is, you know, potentially beyond the menopause. And if you look at the numbers of women in employment between the ages of 50 and 64, the numbers are going up significantly. There's almost
I think it's about 4.5 million at the moment, over 50 in the workplace.
And these are, again, I mean, these figures are about 3 or 4 years old. So if you look at them, so these numbers are increased. The proportion of women over 50 in employment has gone up like almost like threefold.
Hugely.
It is, so it's got a huge impact. And again, it's an area where not every woman may feel comfortable talking to her line manager about it. And if you're going to be feeling a bit forgetful, you might be thinking, oh, is it because I've got a bit older? And rather than thinking, actually, it's because you're estrogen deficient, and there is an answer to that.
Exactly. I
So
think
it
the
is
thing
an
is,
area.
I think the thing is, I think it's just a common sense approach, isn't it? You know, and I
Absolutely.
think we need to kind of get away from this idea that, you know, it's about patients against doctors. It's good for everybody. It's good for doctors. It's good for patients. It's good for the NHS. It's as simple as that, really. All right, thank you so much. That was much more extended than I thought it would be, but thank you. It's, you know, it's really good to have those conversations and to know, you know, where the BMS are coming from, what it does. And I'm sure lots of people will be really interested and won't have had a clue what the British Menopause Society does. So while I've got you, I must ask you some questions that many people really want